Believe it or not, there have been 5 other mass shootings since Saturday's shooting in Allen, Texas, according to Gun Violence Archives. That brings us to a grand total of 202 mass shootings so far in 2023, and the second in Texas within a week of each other. They define mass shootings as 4 victims shot. They could be injured, they could be killed, but that doesn't include the shooter. We've gotten to that total, 200, a lot faster than last year or 2021, where we didn't hit the 200 mark until mid-May. In 2020 and 2019, it took us to mid to late June to get there. Last year, there were 647 mass shootings in America, contributing to the 20,200 gun deaths in the U.S. and nearly 40,000 injuries. Last year, remember the mass shooting that captivated the country? It was nearly a year ago, May 24th, 2022, when a gunman walked into Robb Elementary School in Uvalde, Texas, and killed 19 children and 2 teachers with an AR-15 style weapon. The same weapon used this weekend in Allen, Texas. Remember after that slaughter, when police waited more than an hour to stop the shooter for fear of his gun? When Texas Governor Greg Abbott, the next day, said this.
What I do know is this, and that is we as a state, we as a society, need to do a better job with mental health. Anybody who shoots somebody else has a mental health challenge, period. We as a government need to find a way to target that mental health challenge and do something about it.
Governor Abbott said that 1 month after cutting $211 million from the department, which oversees mental health programs in Texas, by the way. Now, how many times have you heard that? After a mass shooting in America, GOP leaders, when asked about reasonable gun control laws, say it's not the guns, it's mental health issues in this country. Even after that school shooting last year, that mantra was repeated by Idaho's elected leaders. From then Republican candidate, now state superintendent Debbie Critchfield, we must have a strategic plan to address the mental health crisis in Idaho and in our nation. To Congressman Mike Simpson, 2 days after the shooting, elected leaders must set an example by coming together to find meaningful solutions that address the clear mental health crisis in this country. Then there was this from Senator Mike Crapo last summer, a couple months after that, in a weekly column on his website saying Idahoans deserve to live without fearing for their life, whether it's at the supermarket, at school, or at home. He said effective and implementable solutions must address the factors behind these heinous acts of gun violence. First, strengthening the shortcomings in our mental health system, he said. He wrote. Well, he wrote that article, by the way, to explain why he voted against a bipartisan Safer Communities Act, because he said it contained funding for states to implement red flag laws, which would allow to temporarily take away the guns of anyone who has shown signs they are a threat to themselves or to others. Because as Governor Abbott said, anybody who shoots somebody else has a mental health challenge, period. Remember? But according to Senator Crapo, yes, we need to address mental health issues, but take away the guns from people showing signs of a mental health crisis? Nah. That got us thinking about what they all said about Idahoans not living in fear and addressing our state's mental health crisis. After all, it is Mental Health Awareness Month. Just this past legislative session, there were several appropriations bills that were passed and signed into law. At least a dozen of those budget bills had to do with Idaho's Department of Health and Welfare, whose job it is to address and handle Idahoans facing a mental health crisis or just to maintain not getting into one. These bills addressed everything from funding a rural nursing loan repayment program to reducing the Medicaid allotment. But one bill in particular addressed mental health specifically. House Bill 350 dealt with the Division of Behavioral Health budget, from drug treatment programs to increasing the number of beds at state hospitals to general mental health services for both kids and adults, which actually accounts for about a third of the nearly $150 million budget. The bill actually increased spending over last year by about 9%, and it passed, but barely, with a 40-29 vote in the House and by just 1 vote in the Senate, 18-17. Many of those no votes came because of a section of the bill which dealt with grant funding for naloxone, the overdose drug, and it limited those grant funds to only first responders. Many believe this was limiting a life-saving device from the general public.
And I can't, in good faith, support this with that language in there. I think it's policy, not an appropriation piece. So
yes, that bill got a lot of no votes, House Bill 350, because of that naloxone addition. But a lot of them came from the same group of senators who likely would have voted no on it regardless, because they voted no on a lot of other DHW budget bills. The names of Senators Carlson, Foreman, Hart, Herndon, Lenny, Nichols, Akunowitz, Tays, Trakel, Zuderveld, they all showed up on the nay side of almost all budgetary votes. Why? Let's let one of them explain.
I voted against almost every budget bill, literally, like almost all of them. It's the big spending mentality is what's going to turn Idaho into Colorado.
Okay, so voting no on everything just to prove a point is certainly a tactic. But if mass shootings are becoming more prevalent and the answer to stopping them is to do a better job with mental health, then where's the logic in voting against anything that might do that? Especially given the most recent State of Mental Health in America report. When it comes to those dealing with a mental illness and access to mental health care, Idaho ranks 50th out of 51st. Same place we were the year before.
I have